Thank you everyone for joining this installment of the Root Cause Coalition's How-To webinar series. We're going to give everybody just a few moments to get in the webinar room before we go ahead and start today's webinar. To give you some logistical items, this webinar is being recorded and will be available for viewing on the Root Cause Coalition website later this week. The panelists will be taking questions at the end of this webinar, so if you have a question for one of the panelists, please type your question into the question pane located at the right side of your screen. We'll give you some time at the end as well to type in those questions, but if you have them ready right now, that would be great throughout the show. Thank you so much for joining us, and at this time, I'm going to pass it off to our wonderful panelists.
Thank you, Monique. This is Vivian Nava-Schellinger, and I'm the Associate Director of Strategic Partnerships and External Affairs at the National Council on Aging. And I, along with my colleagues, who I will let them introduce themselves in a minute, are very happy to join you all today for this how-to webinar, Collaborative Leadership and Flexibility to Address the Needs of Older Adults. We can move on to the rest of my colleagues that are here with me in the room, but I will note that, Monique, I'm very, very thankful to the Root Cause Coalition for welcoming us today and really providing an open door to for you all to learn about who we are. Some of you may know who we are, maybe know some of those on staff here at NCOA, but this is a really great opportunity to create those partnerships, hopefully in the future, and to learn a little bit more about what we do. So with that, I'll kick it off to my colleague, Leslie Freed.
Hi, and it's a pleasure to be with you all today. My name is Leslie Freed, and I'm the Senior Director at the Center for Benefits Access.
Hi, everybody. My name is Lura Barber. I'm the Director of Hunger Initiatives here at NCOA, and I'm so pleased to be talking with you today about how we can address the needs of older adults together. Monique, could I have the next slide? So some of you may be asking yourselves, who is NCOA, right? So we are the national voice for every American's right to age well. And we have a vision, and that is that we want to be in a just and caring society where each of us, as we age, can live with dignity, purpose, and security. Our mission, next slide, please. Our mission is to improve the lives of millions of older adults, particularly on those who are struggling. And our social impact goal is to improve the health and economic security of 10 million older adults by 2020. And I'm happy to say that we have met that goal, or we will be meeting that goal a year early. Great. Next slide, please. So how do we do our work? Our network of community partners is truly essential to NCOA's ability to reach older adults all across the country and to carry out that mission and that vision. We have a network of community partners that is geographically diverse, that serves a wide range of elder populations, not only elders themselves, but their families and their caregivers. They're local organizations, they're state agencies, they're nonprofits. And they have a variety of funding sources, whether that's government grants, they work with foundations. And through this webinar, we're going to go into some greater detail about each of these, but I'll just share them with you now. The National Institute of Senior Centers, our chronic disease self-management education programs, falls prevention, economic service centers, benefits enrollment centers, hunger initiative partners, senior community service employment program, the Aging Mastery program, and of course, if you're interested, this link here will take you to a map where you can find out who we work with in your area. Next slide. So first, I want to talk about our Benefits Enrollment Center Network. The acronym that we use is BEC, and that's what you'll hear me say a lot. So our Center for Benefits Access, which Leslie leads, my colleague who'll be speaking a little bit later, receives funding from the United States Administration for Community Living to support these BECs. ACL is the acronym for that government agency, and that's part of HHS. That's part of Health and Human Services. So what do BECs do? What is a Benefits Enrollment Center? Is it a brick and mortar building that we own, where we operate, and people that are employees of NCOA work there. That's not what a BEC is. A BEC is an entity, it could be any type of organization that provides a seamless system of outreach, enrollment, and follow-up to help low-income Medicare beneficiaries access the core programs that improve economic security and health. So the ones that we consider core benefits for this population of older adults are the Part D low-income subsidy. This is a benefit program administered by Social Security Administration that helps pay for your Part D drug plan on Medicare. The second is the Medicare Savings Program, or MSPs. There are three kinds of these. So you might have heard of things like QIMBY, SLIMBY, or QI. And I apologize for all of the acronyms that I'm throwing at you right now. But if you have questions about them, please, feel free to put them in the question box, and Monique can help us sort that out during the Q&A. The third is Medicaid. So Medicaid pays for health care for people who have very low incomes. And the fact of the matter is that most older adults at some point or another do run through most of their resources and then become enrolled in both Medicare and Medicaid. Those folks are called dual eligibles, and that'll come up a little bit later. But it's important to note that Medicaid just isn't a program that serves younger people. Most Medicaid spending is on people 65 and older who are also enrolled in Medicare. A program that many of you may be familiar with is the Supplemental Nutrition Assistance Program, or SNAP. It might be called something different in your state, like CalFresh. The Low Income Home Energy Assistance Program, or LIHEAP, which helps pay for heating or cooling assistance. Again, in your state, it may have a different name. And then there are other benefits that some of our benefits enrollment centers, along with these core benefits, also help people enroll in other programs and services that they might be eligible for. Next slide. Where do we work? Where do we fund benefits enrollment centers? Currently, we have 87 benefits enrollment centers serving individuals in 43 states. So the states here that are shaded dark blue represent where benefits enrollment centers currently serve. Some are only operating in specific counties or communities, while there are others that are statewide. The models are diverse, as are the types of organizations that we fund. Can you go to the next slide, Monique? There's no cookie cutter formula for what makes a good BEC. Some are small community-based nonprofits, while others are part of larger networks of state agencies providing aging services. They might be call centers or ethnic community groups, senior centers or area agencies on aging, hospital systems, faith-based groups, or food banks. But all of them are committed to serving vulnerable populations and connecting them to the programs they may be eligible for. And many of them, most of them, go above and beyond that to link their clients to other sources of support in the community, whether that's housing or transportation or food pantries. Next slide. Our BECs have taught us some really good lessons about what it takes to forge partnerships and expand outreach to communities. And the thing is that it takes time and it takes persistence. So what are some of the examples that we've seen of this in the field? So one comes from our partner, Isabella Geriatric Center in New York City, where benefits specialists attempted to bring a SNAP on the Road program to several senior centers to help older adults apply for the Supplemental Nutrition Assistance Program. However, insufficient time was spent gaining the trust of the people living in the senior center communities, and the project goals were not met. Carol Ban, who is the Director of Aging in Place Programs at Isabella, told us, "It would have been more effective to simplify the approach by focusing on one senior center with a steady weekly presence and engaging the community to build trust." I think failure always presents an opportunity to learn, and that is something that we partner with our BECs to do. So we're always thrilled when they see how they can pivot and serve people better. Another example comes from Rio Arriba, which is our Northern New Mexico Benefits Enrollment Center. They created a consumer advisory committee to better understand the needs of their Spanish-speaking and Native American clients. The Senior Advisory Committee holds listening sessions to gather community input about their needs. It's a great display of empathy and listening that's essential to building these partnerships. And another example comes from the ARC of Prince George's County in Maryland, which had 3 established grant partners under the Benefits Enrollment Center, and believed that with a reach of 10,000 potential beneficiaries, these partners would bring in at least 75% of their referrals. The lesson that they learned is you cannot assume that partners understand their role. They realized that their partners needed more support and guidance. They told us that due to the high turnover rates for case managers within our grant partner agencies, they found they needed to do multiple follow-up and face-to-face trainings at their staff meetings. So that tells us you need to train, retrain, and follow up with partner staff. Partnership is not a one-and-done deal. It is a relationship, and you got to feed it. Okay, next slide. I think that it's important when we're talking about addressing client needs holistically that we get real and we get gritty about what that means, in the community. Our BECs and other NCOA partners have shown us that none of our services exist in a vacuum. Collectively, we all want the same outcomes for our clients, improved financial security and health. So how can we tag team to offer other programs within our communities? So one example of an organization, a partner looking holistically at their clients' needs, comes from Shepherd's Center Central in Kansas City, Missouri. They have the Shoebox Project. This is a walk-in clinic to help low-income seniors and disabled persons who may have limited education or cognitive issues or vision impairments, or perhaps English is a second language for them in reading, and it's hard to understand the forms that are in letters that are sent to them. The goal of this Shoebox Project is to assist persons with organization, form completion, and education about what's junk mail and what's important to keep. And at the same time, they assist with Medicare education, with benefits screening, and connection to other services. A lot of our network also tries to capitalize on conducting outreach and identifying partners at places that are frequented by seniors and persons with disabilities. So this looks different in every community, but things that might be in your community where you can connect with seniors are things like community shredding events where you can shred your personal papers, a free tax clinic from VITA and AARP. Things like that, thinking creatively and thinking broadly about your community are important. And to talk a little bit about how NCOA is partnering at the national level, I'm going to ask my colleague Leslie Freed to talk for a few minutes.
Thank you, Laura. So one of the ways NCOA works to improve the lives of older adults and people with disabilities is through working with other organizations in a collaborative manner. And this is especially the case on matters of public policy. So we are a part of several collaborative organizations really to move the needle. First and the largest is the Leadership Council on Aging Organizations, which is about 70 organizations that work with older people or advocate on their behalf. And they really range from AARP and the Medicare Rights Center to Leading Age, which is really an association of housing and long-term services and supports organizations. So the LCAO is a coalition concerned about the well-being of older adults as well, and we're committed to representing the interests mostly in the policy-making arena. NCOA is one of the 5 rotating chairs, and in fact, we just handed over the gavel in June of 2018. But primarily, we focus on health policy, income security, and budget and appropriations issues. Next, we're a part of the Disability and Aging Collaborative, which is a coalition of national aging and disability organizations working to advance long-term services and support for older adults and people with disability. We helped form the coalition about 8 years ago, really during health reform, and was one of the first coordinated advocacy efforts among aging and disability communities on long-term services and supports. And we're now really focused on enhancing access to home and community-based services and the duals integration, the Medicare-Medicaid integration, and manage long-term services and support. And that coalition meets every other Friday for 8 years. And then finally, the Improving Medicare Markets Initiative is our newest collaboration, and we started this in 2014. It's an expert advisory group that has met also every 2 weeks to really think about improving the Medicare shopping experience and especially the tools to make decisions about Medicare choices. Because in order for the Medicare marketplace to really work, Medicare beneficiaries have to be able to make an informed decision and have the information clear and concise and understandable. So this coalition has everything from drug manufacturers, pharmaceutical manufacturers, to health plans, to Medicare advocates, to academics. And it's a real diverse group of stakeholders who are very involved in improving the Medicare experience. And finally, the MapRx is a coalition that started in 2003 when the Medicare Modernization Act was just being enacted. And it was a group of stakeholders, both many of which were patient groups, as well as Medicare advocates and pharmaceutical companies, really focusing on the beginning of a whole new Medicare benefit, the Medicare drug benefit. And we have been an active partner in that coalition for the last 15 years. I'm going to send the slides back to Laura, who's going to continue the webinar.
Thanks, Leslie. So along with the Center for Benefits Access, NCOA also houses the Center for Healthy Aging. This is also funded by the Administration for Community Living, and the goal of the Center for Healthy Aging is to increase the quality and years of healthy life for older adults and adults with disabilities. The National Resource Centers provide technical assistance and support to state and community-based organizations to implement and sustain evidence-based health promotion programs. They also serve as a national clearinghouse of resources, best practices, and information for chronic disease self-management education, or CDSME, another acronym, and falls prevention. Other areas that our healthy aging programs address are things like behavioral health, physical activity, immunizations, and oral health. The Center for Healthy Aging engages in many technical assistance activities, all of which you'll see here on the slide. Things like one-on-one support or an annual meeting, webinars, online tools and resources, best practices, networking opportunities, and work groups. If you're interested in learning more about these, please look at the Center for Healthy Aging on our website. Some of the key partnerships that sustain the impact of the Center for Healthy Aging are groups like the Administration for Community Chronic Disease Self-Management Education and Falls Prevention grantees. And again, if you're looking at our partnership map, you'll be able to see those. Monique, could you advance the slide, please? We also work with aging and disability resource centers, area agencies on aging, other community-based organizations. We also lead the Falls Free Initiative state coalitions on falls prevention. We work with healthcare organizations, senior centers, state health departments, state offices on aging, and tribal organizations. You might be asking yourself now, who don't we work with? That's a great list, and there's much, much more on our website. Next slide, please. NCOA also houses the National Institute of Senior Centers, or NISC. So NISC is the only organization in the United States that is solely focused on the needs of senior center professionals. The NISC leadership, senior center professionals, and NCOA staff work in partnerships to address the issues that are most important to elders. And our advocacy team ensures that senior center concerns are heard on Capitol Hill. The fact is that for many people out in the world, senior centers are what they think of when you say aging network. And they're a really important part of our network here at NCOA. So NISC resources are going to be focused on the issues that senior centers care about, things that are going to affect their ability to provide those services that seniors need. And as generations shift and interests shift, the senior centers can change with them. So, next slide. NISC is also a great avenue to become connected with NCOA because NISC, along with senior center memberships, also provides what they call their senior center business affiliate. You do not even have to be a senior center to be an affiliate. So NISC senior center business affiliates gain things like valuable news and information. Every week, members find the latest news in aging right in their inbox through Senior Center Voice. We also do research. NISC provides research and promising practices. So as an affiliate, you can access our online source for senior center related research, promising practices, and presentations. We do webinars. We also have a Crossroads community, which is our online discussion boards about the issues, concerns, and big ideas that affect older adults in the community. We're also engaged in grassroots advocacy, but whether you're a senior center or a business affiliate, you can get involved and help us as we keep tabs on aging policy in Washington, D.C., you can help influence the debate. NISC also shares information about NCOA programs like benefits access, healthy aging programs, mature workers, senior centers, and much more. And again, further information about that can be found on our website. Next slide. The next program that I'm highlighting today is the Aging Mastery Program, and we like to call this a playbook for aging well. I mean, the fact is that people are living much longer than their parents or their grandparents, and that longevity brings with it challenges as well as joys, but most people are not prepared for what aging brings. Baby boomers are facing economic realities that are very different from their parents' generation, like lack of pensions and increased healthcare costs. We've found that for most older adults, it's not enough to recommend that they exercise daily or save more. People need specific, engaging opportunities that are motivating and that support them to take action. So, to address these needs, NCOA created the Aging Mastery Program to help older adults create their own personal playbook for aging well. AMP, which is what we call Aging Mastery Program, started in 2013 as a pilot project with 5 selected senior centers, and now we are in over 300 sites across the country. Aging Mastery reframes aging through fun and engaging educational programs that motivate people to take action. The program's philosophy was, and it continues to be, that people can be empowered to change behaviors in key areas that are essential for positive aging. Aging Mastery gives older adults the knowledge and tools they need to adjust to the realities of aging and to make the most of the gift of longer life. Aging Mastery guides individuals through this phase of life so that they can continue to achieve autonomy, mastery, and meaning in their later years. Our long-term objective is for baby boomers and older adults from diverse backgrounds nationwide to amp up their lives. Aging Mastery can be accessed in 2 forms. The first is an in-person Aging Mastery program, and the second is a self-directed Aging Mastery starter kit. In both options, individuals take key steps to change behaviors through changing habits, things like hydration, nutrition, getting enough sleep, your social connections. These things are critical to aging well, to successful aging. And they accomplish this by, and so these playbooks are personal and they really work. I just found out this morning that these are now available on Kindle and on Amazon. So next slide. So a little bit more about Aging Mastery, the community classes. So all these different ways that it can be accessed in person, in home, and digital Aging Mastery. That's what we're working toward. All right, next. What do participants say? You know, I think it's always nice to put a voice and a face to the numbers. And the numbers tell us that this program is effective. It is now evidence-based. But if you look at the faces here of folks who have successfully completed the program, they say things like, AMP gives me a sense of personal satisfaction in knowing that I am actively doing something to improve and learn the things I need to do. It was also nice to get to know the other participants. Social dimension of this is so important given what we know about the impact of isolation on health. Other people say AMP has made a big change in my overall attitude. I have a much more positive outlook on life than before, and I love creating my gratitude list before going to bed. And that's actually something I've personally adopted. All right, and with that, I'm going to send it over to my colleague Vivian, who's going to talk about partnerships.
Thanks, Laura. So again, what you'll see here is that we cannot do what we've done for over 65 years without those partners in communities, private sector partners, public, federal agencies, state agencies. We're really all over the map, which you can access online.
Yeah.
But why, really at the end of the day, why do these partnerships truly matter to us? Please advance the slide, Monique. They matter because when you're really thinking collaboratively, I guess I go to the saying, rising tides lifts all boats, and sometimes that's done when working in fundraising, but really I think that speaks a lot to the work that we do as an organization. We really cannot do it alone, and only through being collaborative and connecting on certain touch points can we actually create programming, much like some of the examples you saw with our benefit enrollment centers, services and programs that really fit the needs of a community and are unique, just like the communities that we serve. Mobilizing communities embeds brand awareness in the lives of everyday people. That's another thing that we can't do without our partners, and that's really empowering communities by recognizing what kinds of programs and services we offer. And the only way we can do that is by using the voice of partners to really go out there and speak to the services that we offer, to speak to the work that we've done in communities, to speak to our membership in certain collaboratives and organizations for the last 10, 15, 20 years. Familiarity with communities and contextual constraints provides opportunities to identify shared values. When I go out into the community and I visit a senior center, whether that senior center is a member of our National Institute of Senior Centers or it's a senior center in a community that hasn't heard of us before, I think what's really important is that we are in communities every day, either us as a national organization or through our partners, to really identify what those constraints are in communities and what those complexities are, and have really honest conversations with our partners and expect that kind of transparency from our partners when they encounter a problem in their community and look to us to find solutions. The opportunity for those outside the sector and or business of aging to identify opportunities to address societal problems. That's one thing that I talk about continuously in partnership work, are those unlikely allies. So those partners in whatever sector they may be that you may have, that we may have some sort of overlap. There is some sort of connection. For instance, when thinking about caregiving issues, it isn't often, and maybe just recently, that people are starting to talk about millennial caregivers and really the kinds of contextual constraints and social constraints that are put on millennial caregivers who are maybe living in intergenerational households and thinking about not only their needs, but maybe the needs of their children, maybe the needs of their families, but also the needs of the older adult that they're caring for. And why do partnerships matter? They matter most when they emphasize transformation over transaction, and that's one thing that our CEO, Jim Furman, has really pushed forward in the last couple of years and really thought about when trying to achieve our social impact goal. And that's that we need to make sure that we're continuously thinking about how to transform communities and how to transform the individual lives of people before we're thinking about a transaction between partner and partner. And I think when you really think about partnerships in that way, then you're able to truly make change in a community as opposed to some sort of solution that you're trying to find that doesn't fit within those community needs. Next slide, please. Another thing that you might ask is how do we find these individuals? How do we reach these hard to reach populations? And I think the answer to that question really goes to the heart of what makes a good partner. Both parties need to understand that they're going to share the workload. That is the I guess kind of the leading understanding when creating a partnership is that you evaluate strengths, weaknesses, and capabilities and resources of both partners. And you really don't expect something from a partner that you know from the start they just can't deliver. We also need to remember to share resources. This should never be a one-way street, as information is key to healthy partnerships. A sharing of resources, again, an evaluation of strengths and weaknesses is something that's really key to making the relationship a good one. And of course, building trust, as we heard earlier, in communities is key and important. Building trust is often difficult. You have to take the time to remind yourself when doing work on the national level or in communities that it takes time to be authentic. It takes time to put yourself out there and to say, these are the services, the programs, here are these innovative tools that we have to offer. But it's going to take time for people to be receptive and to trust that. And you have to give your partner or those in the communities that you're working with that time. Don't assume potential partners know who you are or your exact role in their community. Again, as we're out in communities and we're meeting with these community-based partners that we've already been in communication with, we always make sure that our staff members are also meeting with those that we've never maybe come in contact with. That senior center, again, that isn't a part of NISC in the community that you're attending a conference in, or that coalition that maybe we've never, because it's a state-based coalition, maybe we never really run into, but they're advocating for the policy changes that we are too. So take the time to teach them in the most resource-efficient way possible, whether it's through webinars, whether it's through information sharing, whether it's through a cup of coffee. I mean, whatever it may be, I think what matters is that we're teaching each other who we are, what we have to offer, and where we can find some synergies. Personal narratives tie our organization, offices, and positions to the work we do and create shared value in an authentic way. This, in turn, helps with building trust. And one thing we've done in our partnership work across the organization is not only do we reiterate and believe in the vision and the mission of the organization, but I think in the aging space, each one of us has a personal story or a personal narrative that drew us to this work. And I hate to put my colleagues on the spot, but really, you know, for me personally, I grew up on the border in El Paso, Texas, and I have a very, very deep tie and connection to my community and to the resources that I know that my community needs. And my grandmother actually was a cook at a senior center. And I grew up going with her to the kitchen and interacting with other older adults. And really that's near and dear to me to know that there are services and resources out there for older adults who really count on those community partners that we actually work with now. Lura, I don't know if you want to share just kind of what drew you to the aging space.
For me, it was that I had always had very close relationships with my grandparents, and I grew up as a young child with them being actually our next door neighbors. And I would go with them to the senior center and for lunch. And I didn't realize how deeply that had affected me until after I finished college and I was looking for my first job. And I was lucky enough to be hired as a VISTA paralegal, a legal assistance organization in Chicago working with older adults. And I had clients that were literally 4 times my age, you know, but, you know, I found that I just really loved working with older adults, learning about the interesting things that they had done in their lives, you know, helping them resolve issues, and really creating friendships, you know, that I still think about fondly. And that really started my career in aging.
And Leslie?
So mine was, I started in aging because Ronald Reagan was president when I graduated from law school, and I wanted to be a legal aid lawyer, but the only place there was funding was through Older Americans Act programs that provided legal services for senior citizens. He was trying actively to defund the legal services programs at the time. So this was the job I got in 1985, and I loved it. I love my clients, and similarly, as Laura said, you listen to their stories and their history, and the fact that as a lawyer I could help them really made a difference and an impact on my life. It became a passion, which has become my profession.
Well, thank you. I mean, I hate to, again, put my colleagues on the spot, but I really think that when trying to be a good partner, what makes a good partner is bringing not only your authentic self to the table, but really relaying what is your personal narrative. Why does not only does your organization matter, but maybe, why are you doing the work you're doing, and why does it matter? Next slide, please.
Can I just add, this is Lura. It's actually auspicious today. Today's my mom's 65th birthday. Yes.
Eligibility.
And she is enrolling in Medicare today.
That's fantastic.
Yeah.
That's fantastic. So your story does matter.
Yes, absolutely. She actually asked me for advice, which was the first time ever.
Well, thank you. And I'll actually give it to you, Laura, to talk about our conference.
Yes. So NCOA is for the first time hosting our own national conference. It's called Age Plus Action. And it's this June 17th through 20th here in Washington, D.C. It's going to be, if you're familiar with D.C., it's going to be right downtown by Gallery Place. And we are bringing together more than 700 professionals and advocates working at the local, state, and national levels to improve the health and economic security of older adults. So some of those highlights are going to be plenary sessions focused on the aging experience for American women. So Women in Aging is our theme this year for Age Plus Action. We're going to have educational sessions featuring best practices in all of the programs that we've just talked to you about, including evidence-based healthy aging, benefits outreach and enrollment, senior centers, and things that are focused on digital marketing to older adults, other kinds of tools and resources and products for seniors. And we're going to be awarding leaders who champion older adults and every person's right to age well. We are hosting a Capitol Hill Day to educate members of Congress. We'll be holding multiple networking and social events, and we'll also have an expo hall with vendors and exhibitors. So there are opportunities to connect either as a participant, as an exhibitor, as a sponsor. All of that information can be found at ageaction.org. Registration will be opening, I think, in the next week or two. So, and with that, and at that point, we'll also have, I think, a basic agenda that people can look at. It's very exciting. There's no better opportunity to really meet all of these partners that we've talked about today, and learn a lot. So can we have the next slide, Monique? So as we've said throughout the webinar, if you want to learn more, you can visit NCOA.org. You can sign up for our alerts, our blog posts, find ways to network. You can become an affiliate of the National Institute of Senior Centers. You can follow us on social media at NCOA Aging on Facebook, on Twitter. I don't think we're on Snapchat yet, but who knows, maybe someday. And then you can also share our free trusted tools with older adults, benefitscheckup.org and mymedicarematters.org. If you want to partner with us, you can reach out to Vivian directly. Her email address is here. And you can reach out to Leslie or I, really any of us. Our offices are across the hall from each other. So reach one of us and you'll reach all of us. If you want to partner, we are looking to build authentic, deep, and meaningful partnerships so that we can expand the way that we're connecting with seniors and in order to improve their lives. Vivian, do you have anything to wrap up?
Yeah, I think what I'll say or what I'll add is if you have any novel ideas or you yourself think you might be one of those unlikely partners where maybe some portion of your work touches the aging space or maybe will one day, we welcome you to send an email, phone call, whatever it may be, but we're really excited to just, again, think about where we still have gaps in the work that we're doing, and where we can really connect with seniors and older adults in your communities and across the country. Thank you, Monique, for everything. This wraps up the webinar. Are there any questions?
Yeah, so thank you so much for that really informative webinar on your programs, on how to create successful partnerships. I'd ask attendees at this time, if you have questions for any of our panelists, to type them into the question pane, usually located at the right side of your screen. While folks are doing that, I think, first off, happy birthday to your mother, Lura. I wish her a sincere happy birthday from everyone here at the Root Cause Coalition.
Yes, I'll pass that along.
And thank you all for sharing those personal stories about why you got involved in the work that you're doing. I think in addition to, sharing your personal story, I think it speaks to a larger need for all of the work that we're doing to put those faces to the people that we're serving in the programs that we're doing in the communities around the country. Changing that narrative so it's not just numbers, it's your grandma, it's your uncle, it's your brother, it's your sister. I think that's really key to, continuing the work that we're all doing. So looking at some questions that we have from our audience, one attendee asked, you touched on the importance of incorporating elements of design thinking into the process. Can you comment on other innovative approaches, those that maybe involve data or technology potentially?
I think this is Vivian. I can actually kind of tee it off, I think, to Laura, because this is more in her wheelhouse. But we are in a digital transformation era of NCOA. Not to say that we aren't continuing, our investment in print resources and thinking about how our clients, customers, individuals in the community like to receive information. But also thinking about how we can be digitally connected and maybe even remain digitally connected to those caregivers that are caring for those older adults. One way that we're doing that is we're engaging in different pilot programs. We're engaging in an SMS texting pilot program to monitor enrollment into SNAP. We're also engaging in a part of our digital transformation phase is building the house, I'd like to say, we like to call it, of a financial wellness platform that I know Laura can talk just a little bit more about, but I think that hits innovation, and hopefully that answers your question a little bit.
Yeah, that's a great question, so I want to thank whoever asked that. I think the past few years have really been a transformative moment for the organization, and I know that that's true across the nonprofit sector, but I think NCOA, we've been putting a concerted effort into this because the demographics require it. Each day we have 10,000 people aging into, quote unquote, like senior citizen status. They're turning 65, and that, like we've said, that brings with it some challenges, right? So digital tools and digital marketing have been really important tools for us to expand our reach, particularly among the younger seniors who are very digitally savvy, and understanding the platforms and the tools that people are using to access information. So we've done things. We have a multi-year campaign using Facebook ads and Google ads to give people information and educate them about SNAP and their own eligibility, helping them download the applications appropriate for them given their location through Facebook ads that lead them to benefitscheckup.org, which if you have not had a chance to browse through, I suggest that you take a look because it is the absolute most comprehensive online resource for all benefits and programs related to older adults. It is free, it's unbiased, that we have rules on there that are specific and they're updated on a regular basis. They're specific to each state and sometimes down to the county, because you put in your zip code at the top, and that's how we learn what questions to ask you and what programs you might be eligible for. So we've reached, through that, we've helped over 2 million older adults and caregivers download SNAP applications, learn about eligibility and how to apply. And the next iteration of that was something we called Snap Lab, where we used Facebook ads and a shared Salesforce data sharing on the back end to use ads to create referrals to our local partners. So leveraging the brand, the authenticity, the connections of our local partners with their community, and pairing that with the power of digital marketing without requiring them, often on a shoestring budget that they're working on, to try to get up to speed on all of this stuff. So it became a learning partnership as well as an opportunity to reach more seniors. We also tested that in Spanish with our partner in Las Vegas, which has a Spanish language call center, and the ads themselves were in Spanish. And then finally, as Vivian noted, the next iteration of that has been an SMS texting pilot that we are embarking on starting in March. And that it will depend on the status of the SNAP program funding at that point. But the idea of it is to, when somebody downloads a SNAP application, if they opt in, then we would use SMS texts, which are very basic, to help them go through the process and create nudges as part of behavioral science. And then Vivian also mentioned our financial wellness platform. And I know that from my experience working in legal aid, that a lot of people need to sit across the desk from somebody who understands them, who's empathetic, who knows the right questions to ask, and tailors that experience to that particular person. The goal of the financial wellness platform is to basically kind of create that in a digital space. So using, state-of-the-art, all of our good content, state-of-the-art artificial intelligence on the back end, so that it's personalized for each person who comes in to learn what is most relevant to them to meet their financial needs. And so right now we're in the very early stages and looking for partners in that work. So if that's something that interests you, or you just want to learn a little bit more, please contact me. I don't want to take up too much more of our Q&A time going into it. But it's all by way of saying that NCOA is dedicated to innovation, because we know that if we don't do that, we're not going to be able to reach all of the seniors that are out there who are struggling or who could benefit from learning a little bit more about how to manage a chronic disease, or how to use their home as a resource to stay at home, how to, if they want to go back into the workforce, how to retrain, or how to do a job search when, maybe that hasn't been something you've done for a few years. So there are a lot of opportunities to partner, both in terms of the existing programs, but also if you've got ideas about products or programs or things like innovation and creativity, we're really good partners around that, and we're eager to connect. So I would love to hear from folks if that's something that's interesting to them.
Can I just add one little point in it? Laura talked about the Facebook ads and the Google ads for SNAP benefits. We also have Facebook ads and Google ads for some of the other benefits that older adults might be eligible for. And we did some messaging research and really focus on older adults live on fixed incomes, but their expenses are not fixed. And so focusing more on just trying to help older adults meet their needs rather than talking about quote-unquote low income, because we found that messaging really doesn't work well with older adults.
Thank you guys for those answers. We had another question come in, and this is about a specific, just a question about if you're partnering with anyone specifically, and I like to are you in any active partnerships with the Humane Society or local shelters or other animal rescues for older adults that have an animal that maybe can't bring their animal into a home or something like that, or pair them with an animal so that they have someone to be around with?
Yeah, so this is Vivian. We actually have had past conversations with PetSmart, just thinking about how to, one of their main concerns, aside from disaster relief support services, are to make sure that that companion animal, or they call actually those with animals pet parents, and so that pet parents do not struggle to keep with the basic needs to keep their pets in their homes, their children in their homes, their fur babies. And so that's something that we've actually talked to PetSmart about. However, on the nonprofit side and at the local level, we have never spoken to the Humane Society or any of the chapters of animal shelters that maybe have those kinds of programs available as well. I think that would actually be a really nice opportunity to include some of those resources on our benefits checkup website, because we all too often ignore the fact that for just thinking about social isolation and thinking about some of these factors that our Aging Mastery program covers, that for some older adults, their fur babies really are everything to them, and prevent social isolation. So I would actually be really welcome anyone to contact me about a partnership like that.
Thank you for that. And just an aside, fur babies are our children, so that's
yes, they are.
And I think it speaks to something about the need to meet people where they are and listen to what the community needs. I think in many times when I talk to folks who are interested in engaging in partnerships, in community interventions, the first thing they do is think about what they, believe the community needs and not what the community actually needs and wants. So I think doing a little bit of a pivot on best practices for partnerships, in your experience, what has been maybe the biggest misstep for folks looking to engage in a partnership either with you or with another community organization? What was the biggest misstep, and how could they have maybe mitigated that?
Sure. I think that you kind of hit it on the head, Monique, in saying that too often national organizations, and that's really the outlook that I came to the organization with, is that too often national organizations try to prescribe a solution because they have data on the problem, but it's really about what the people are experiencing, and through conversations, through relationship building, through actually being on the ground in the community as a person working at a national organization. It's not just hearing that from your partners, but it's in actually being physically present in that community to experience whatever it is they may be going through, whether it's after a disaster, whether it's seeing, what kind of community resources are lacking, seeing how active and engaged maybe older adults in their communities are, and just kind of waiting for that opportunity to be engaged on a national level or to have a forum to be able to engage. So I think that's really the biggest misstep that I've seen, is that all too often organizations are very prescriptive in terms of, here's a solution to problem X based on the data we've seen. But I think more than that, again, it's about meeting people where they are. It's about asking people what they want, because at the end of the day, some people might want a grocery store and not a park. And I hate to say that, but at the end of the day, you need to know what the community needs, who they are, how they identify themselves. So that's really a misstep that we've seen. That's a misstep that maybe at times, maybe even us as an organization have been guilty of. But I think that really goes to show that we're really transparent about, where we see gaps, where we've maybe had a misstep or two, where we can provide for collaborative leadership in a way that drives maybe not just solutions, but really thinking about a problem in a different way. Maybe not yet, creating a solution, because we may not be there yet, but it's in approaching the problem differently. And it's also in empowering those people in communities to have a seat at the table. I hope that answers the question a little bit.
It definitely does. Thank you so much, Vivian. And I would just say to all of our attendees who have asked some pretty specific questions on NCOA policy programs, I have put their contact information back up on the screen. I encourage you, if you have any specific questions or are interested in any more information about items that they talked about here on today's webinar, please reach out to them. I'm sure they will be happy to talk with you and answer your questions and potentially partner with you here in the future.
Thank you so much.
Yeah, thank you guys so much. And I think we have a few more minutes, but I'm not seeing any additional questions from our attendees. So again, if you have any follow-up questions, feel free to reach out to these wonderful experts here on the line. Thank you all so much for joining us today's webinar. Thank you for our panelists, and I hope you have a wonderful rest of your day. At this time, I'm concluding the webinar.
Great. Thank you so much.
Thank you. Have a nice day, everyone.